Thank you. It's a real delight to be here, and I'm sorry I'm the stand-in, but hopefully I will do you proud this afternoon. So, at the start of April this year, I became the president of the Association of Directors of Children's Services, and that's a role that's an absolute privilege, and I'm really honoured to be undertaking. In my inauguration speech, I outlined my priorities for ADCS in the coming year. And I'm looking forward to delivering these priorities whilst ensuring that the golden thread of a country that works for children is driven through my presidential year and beyond. So why do we need a country that works for children? It's estimated that there are 4 million children living in poverty. That's almost a third of the child population. And a growing number of these children live in households that are working. This is a relatively new phenomenon. So we need a country that's preparing its children to thrive, not just survive, that ensures that children are kept safe and that have accessible, inclusive educational opportunities. And if the current government wants to achieve its ambition to create a country that works for everyone, we must first start with one that works to get the best for our children. It seems to me like it would be a pretty good start if we agree what a country that works for children might look like. And here is a starter for what it wouldn't look like. It wouldn't be a country that makes children and their families, particularly families in receipts of benefits, and even more worryingly those who are working, poorer, with food banks now appearing in every supermarket. It wouldn't be a country that criminalises young people, especially those in children's homes, for the most trivial of matters. It wouldn't be a country where excessive profiteering by a small number of private fostering agencies was generating significant wealth for a few private individuals on the back of some of our most vulnerable children. But it might be a country that actively supports public sector agencies to engage in a partnership parenting approach, one where not only the local authorities, but police, health, probation, schools and colleges really feel and understand the part they play in being corporate parent for the 70,000 children in public care currently. It might be a country that commits a fixed percentage of its gross domestic product to be spent on children's services, in the same way as we do for defence and foreign aid and so on. It might also be a country that uses evidence of what works when planning services with and for children. One that prioritises early help and early intervention to give our children and families the best chance to stay together and live healthy, happily, safe lives in their communities. It would also be a country that recognises that sometimes the best interest and outcomes for children means they have to live away from their birth families. And local authorities would be properly resourced then to ensure that children who need to be in our care receive this in safe, loving substitute families with access to the best schools, the best physical and mental health care, and are supported by well-trained, properly supervisors, dedicated social workers and other professionals who care deeply about the children's individual unique needs and continue to care for them into independent adulthood. Returning to my presidential priorities, one of my key policy priorities for the coming year is to mobilise knowledge and learning from improvement and innovation and share it widely across the sector. You will have all heard the phrase, data-rich, intelligent, poor. We need to be an intelligence-rich sector, supported but not enslaved by the data that matters. So, on one hand, I'm intensely relaxed about the many projects that the DFE's innovation programme is funding. But what I'm bothered about, though, is how we mobilise the learning from these projects and the other sources of innovation and practice excellence across the country and share it. We need transparency and visibility about the good work of the best local authorities, but also honesty with ourselves and each other as a sector. We need to grapple with the conundrum of what works. It's rarely the case that any initiative or intervention can simply be lifted and shifted wholesale from one place where it appears to work to another without contextualised modifications. This is at the heart of the implementation science, so whilst we must share learning, we need to think hard about the practicalities of replicability. The importance of intervening early has been a priority area for many local authorities. However, difficulties can often lie in evidencing that early help, early intervention is really working. We all believe in its efficacy instinctively. But if we are using it as a tool to manage demand on our statutory social care services and interventions, it could be perceived as failing, giving rising numbers of referrals to child protection services, rising number of children in care. Or, and this is my preferred narrative, We are, through early help and early intervention, identifying children who need the protection of statutory services earlier, and as such, protecting them from further harm and making long-term permanent plans for those children to thrive. Measuring the effectiveness of early help is tricky. Outputs, such as the number of early help assessments completed, can be easily measured. We know that there was 207,636 completed in the year 15-16. However, this tells us little, if anything, about the range of effectiveness of early help services. ADCS completely share the Foundation's view that we need an evidence base that underpins our commissioning and indeed decommissioning decisions, and this evidence base needs to be built on evidence beyond what can simply be counted. Nottingham City has a proud history as an early intervention city and continues to commit to prioritise spend on early help, early intervention and early prevention services. Our early help locality hubs for children, which bring together schools, health colleagues, children's centres, youth and play, family support workers and social workers, was recently described as Ofsted as outstanding. Little glow. Sorry, I couldn't resist having a little glow from that. And they are a key component of our ability to manage demand, and especially keeping demand from our most expensive tiers of support, so helping children who are subject to a plan to avoid then having to come into our care. And we are increasingly taking the learning from children's services and applying it across wider council services, building capacity in families across communities, encouraging communities and individuals to look after each other rather than reliance on a shrinking state. But I will return to tell you a little bit more about the Nottingham story shortly. In response to our desire to understand early help and interventions better, ADCS undertook some of its own soundings. And perhaps unsurprisingly, it found that there was no common definition amongst local authorities of early help. We talk of early help, early intervention, family support, and all broadly mean the same sort of thing. There are no longer any dedicated ring-fence funding streams other than troubled families and small strands within public health grants. So for many local authorities, funding early help is increasingly difficult to sustain. And even with new and innovative ways of working, in the light of the removal of revenue support grant in 2020, the end of the Troubled Families programme also in 2020, which is part of the local authorities' many core early help offer, together with other pressures within local authorities facing, like most notably social care, the ability to fund this going forward is increasingly hard. There are no statutory data collections on early help, so local authorities do different things in respect of recording and monitoring early help. Indeed, some don't record at all, so comparisons really have no meaningful statistical basis. And despite the plethora of legislation and guidance in children's services policy terrain, none of it is designed to bring coherence to the importance of preventative work. So instead, local authorities must do so for themselves. And in the context, as I've mentioned before, of unprecedented retrenchment in public sector funding, this again is incredibly hard. In these cash-strapped times, local authorities struggle to divert funds from statutory services, such as children's social care, to fund early help efforts. We therefore welcome the DfE's Innovation Fund focusing on this space in the future. Despite all this, ADCS still asserts that there are indications that early intervention should be a priority. Parents have the biggest influence on their children's early learning. Talking and reading to a baby can stimulate language skills right from birth. And this can help to prepare children so that they're ready to learn at 2 and ready for school at 5. Children who cannot read well at the end of primary school are less likely to succeed in secondary school and on into adulthood, and are less likely to learn than their peers. Evidence shows that good early development is crucial for later life. So, for example, communication and language outcomes. A good vocabulary at 18 to 24 months predicts reading accuracy and comprehension 5 years afterwards. Children with a poor vocabulary at 5 are more than twice as likely to be unemployed by the time they're in their mid-30s as children with good vocabulary but similar non-verbal skills. Well-targeted, implemented programmes in early years can improve behaviour and achievement at school. However, there's an urgent need for more high-quality empirical evidence and testing the effectiveness of programmes here in the UK. But now let me turn to talk to you about my day job. So I am the Corporate Director for Children and Adults in Nottingham City, responsible as the Statutory Director of Children's Services for all of Children's Services, and also accountable for the Director of Adult Social Services and the Director of Public Health. Nottingham is ranked 8th of the most deprived districts in England and in the 2015 Index of Multiple Deprivation. Employment rate is low, with just 63% in employment in 14-15. 11.7% of people aged 16 to 64 have no qualifications, and that compares with 8.6% nationally. 67% of Nottingham's children live in workless or low-income households. By the time they start primary school, the vocabulary of children from our low-income families is 12 months behind the national average. Reading skills are at least 14% behind the national average, and at the end of primary school, only 66% of Nottingham's children achieve the expected standards, compared to 74% nationally. So what are we doing about it? Well, in 2008, leaders in Nottingham made early intervention a top priority for the city and committed to a 20-year journey to significantly shift outcomes for individuals and families and to enable a great start for all children. This principle is embedded within Nottingham's strategic planning framework and is championed by One Nottingham, our local strategic partnership. Supported and championed also by our Children's Partnership, early intervention and prevention and early help apply across all ages and are needed at all stages across our system. Our aim remains to break the intergenerational nature of underachievement and deprivation in Nottingham by identifying at the earliest possible opportunity those children, young people, adults and families who are likely to experience difficulty, and to intervene and empower people to transform their lives and the lives of their children in the future. So our key criteria include tackling these intergenerational issues, focusing on those activities that, if delivered, can reduce the number of specialist interventions needed, bringing partner resources together to really make this happen, targeting works at those individuals or families who are likely to have difficulties and who, without effective support and intervention, might need more statutory services. So focusing on a real coherence for children and young people and families within our delivery models, and shifting resources to tackle the complex causes of problems rather than just treating the symptoms. Our early intervention programme is structured around 5 key work streams. The first of these is around governance. So that's about making sure that we're all aligning our priorities across the partnerships, engaging partners and making sure that decision-making is signed off at the Children's Partnership Board to ensure that consistency. We have work streams and projects, so we trial new work and we re-engineer services to best meet the needs through 16 very active pilot projects. In terms of finance, we are trying to understand the relative cost and impact for our services and gradually shifting resources towards those preventative services and towards the ones that are demonstrating good outcomes. And we learn and evaluate. We are being really robust about what does and doesn't work and strengthening the links between research and our own practice. And finally, the area of knowledge management. And this is really trying to understand need in our communities and are creating the hypothesis of what will work to have the greatest of impact. Critical to our success has been implementing both national and international programmes with proven evidence-based outcomes. This has included Family Nurse Partnerships, Stronger Families and the Dolly Parton Imagination Library. And these have been complemented by locally developed programmes which we have critically evaluated, and they continue to go from strength to strength. And these include our Active Families programme, which increases opportunities for families in areas of the city with the highest childhood obesity rates, to engage them in physical activity, to try and make them into healthier children and, of course, healthier adults. We have a big drug aware scheme supported by our schools and delivered through schools to address drug and alcohol issues. And this received national recognition and accreditation as an evidence-based programme by the Early Intervention Foundation. And we're just starting on maths mastery. This is an approach to teaching maths in our early years, so preschool children. And it's based on the schemes that are used with older children in China and Singapore. Where it is different is the scheme assumes, and the teachers assume, that actually there are no ceilings to the expectations of what children can achieve. So there's no streaming, no setting what we think are going to be the restrictions on children's learning, but the lessons are delivered in a way that every child reaches that same point and are pushed on. And it's so far having some very good and promising results. Not all of our early intervention services, though, are targeted at that universal ways. And our interventions at the point where the alternative is that otherwise the child would come into care are just as important to us. And despite relentlessly rising demand, we have managed to keep in the city a relatively stable number of children in care through a comprehensive range of intensive interventions with families and children right at that edge of care point. And for those families that we have worked on, and clearly some children need to come straight into care, but those families that we work on at the edge of care, 90% of these children remain in their families 6 months later without the need to come into care. And we have a variety of educare services which include MST and MST CAN, family intervention projects, and my particular favourite of Safe Families for Children. In Nottingham City, we are aware that it is easy to become swamped by lots and lots of new initiatives. Therefore, we concentrate our energy on embedding evidence-based approaches that are working for us. So, for example, the use of signs of safety methodology is right across our children's partnership, not just in children's social care. The strength of our approach to early intervention, which in partnership with the Early Intervention Foundation has led us to becoming one of just 20 early intervention pioneering places, was behind us successfully securing 45 million from the Big Lottery for our Small Steps, Big Changes programme. Small Steps, Big Changes is a partnership of parents and professionals working together through co-production, parent-powered change to drive the delivery of the programme and focus on helping children to live happy, healthy and fulfilled lives. The programme seeks to positively impact on outcomes for our 0 to 3-year-old children and is focused in areas that are most deprived and developing, first of all, communication, language and social and emotional development and also, importantly, nutrition. Unfortunately, time doesn't allow me to go into the detail of this highly successful programme, but suffice to say it owes at least in part its success to the commitment of our local, now former MP, Graham Allen, and the City Council's councillors. So achieving the Small Steps, Big Changes ambitions, and one of those is that every child under 5 should be enrolled in the Dolly Parton Imagination Library, is one of the City Council's top council plan priorities. But I want to bring us back to where I started. So taking the opportunity today to remind you all as champions for our children and champions for early intervention that ADCS believes we need a country that works for children. A country where help is provided to children and families sooner, where schools and health, our big universal services for the under and over 5s, are focused upon and resourced to facilitate early help, where we recognise the need to learn and remember that we become experts at whatever we practice and we're not afraid of making mistakes. Indeed, mistakes are magnificent when they lead to learning. So thank you.